Picture a middle schooler wearing a thick wool sweater in 90-degree July heat, or a teenager who spends an hour every morning meticulously applying heavy makeup before they will leave their room. Roughly 1 to 2% of students go to these extreme physical lengths every single day to hide their own bodies. Beneath the sleeves and makeup are physical marks, patchy eyebrows, missing eyelashes, and open sores, inflicted by their own hands. When an adult finally discovers these signs, the response is often reflexive. Sit the student down, look them in the eye, and tell them to just stop doing it. Telling someone to stop picking their skin or pulling their hair is identical to demanding someone with OCD stop checking to see if the front door is locked. It is a biological impossibility. This willpower-based approach fails to stop the behavior. Instead, it breeds a profound, isolating sense of shame. This vacuum of understanding pushes a condition that causes real functional impairment further into the shadows, making treatment nearly impossible to access. The Diagnostic and Statistical Manual of Mental Disorders classifies these behaviors as distinct medical conditions. They fall under the clinical umbrella of body-focused repetitive behaviors, or BFRBs, specifically Trichotillomania, which is hair pulling, and Excoriation Disorder, which is chronic skin picking. The physical action of picking or pulling operates as an automatic tool for emotional regulation. The brain utilizes these behaviors to soothe the nervous system. Individuals are often entirely unaware that their hands are even moving until the physical damage is already done. This neurological disconnect makes the behavior an automatic loop. BFRBs hijack the brain's natural soothing mechanisms, turning a physical act into a self-reinforcing routine, rather than a failure of personal discipline. Treating a distinct clinical diagnosis requires evidence-based interventions designed to physically rewire that neurological loop. Habit reversal training, or HRT, inserts an awareness intervention between a trigger and the automatic action. Patients identify precise physical and environmental triggers. Once recognized, they introduce a competing physical response, like clenching fists, making the behavior impossible, evolving into comprehensive behavioral treatment, or COM. COM analyzes a matrix of 5 factors specific to each person: their sensory environment, emotional state, cognitive thoughts, motor routines, and physical location. A licensed professional may also prescribe cognitive behavioral therapy, or SSRI medications, as clinical adjuncts to this behavioral training. Systematically replacing the automatic loop with conscious, incompatible actions allows patients to achieve a meaningful and lasting reduction in the behavior. Untreated BFRBs that persist into adulthood carry severe medical stakes. Chronic skin infections, permanent scarring, and dental damage from nail biting are common complications. Effective intervention must be rooted in clinical access and compassion, moving away from surveillance or punishment. Teachers and school nurses often serve as the first adults outside the family to notice physical signs and open the door to professional care. MentalSpace School provides the systemic bridge, connecting K-12 students and staff across Georgia to these specialized clinicians. Through same-day teletherapy, licensed clinicians provide official diagnoses and evidence-based treatment for BFRBs within the school environment. Immediate access to specialized care means students no longer have to hide in shame. They can finally change the trajectory of their mental and physical health.